Hi, we're members of St John Ambulance Cymru Cardiff Links division. We have put together this video to teach you how to perform life-saving CPR and how to use a defibrillator. If you are doing any of the following within the COVID-19 pandemic, please remember to wear personal protective equipment, mask, gloves and apron if available. For more information, please visit www.sjacymru.org.uk.
First, George will show how to do a primary survey. The primary survey is a quick way to establish if a casualty has any injuries or conditions which are life-threatening. You should do the primary survey every time you attend to a casualty. Within St John Ambulance Cymru, the acronym Doctors ABC is used.
D stands for danger. Before approaching any casualty, you must ensure that there is no danger to yourself. Clear any objects from around the patient to ensure that the environment is as safe as possible. The casualty should only be moved as a last resort.
R is for response. Check to see if the casualty is responding. Say hello and shout a command such as open your eyes or ask questions such as can you hear me. Gently shake their shoulders or for a baby tap them on the foot. Do not shake hard as you could injure them. If there is no response, shout for help.
A is for airway. You will need to check if the casualty's airway is open and clear. Kneel by the casualty and place one hand on their forehead. Place your index and middle fingertips of the other hand under the casualty's chin. Lift and hold to keep their airway open.
B is for breathing. Once you have opened the airway, check to see whether the casualty is breathing normally. Place your cheek just above the casualty's mouth and nose, and you need to look, listen and feel for their breathing for no more than 10 seconds. You need to look at their chest movements, listen for breath sounds and feel for their breath against your cheek. During COVID-19, you should assess breathing from afar by the chest movements. C is for circulation. Are there any signs of severe bleeding?
If the casualty is not breathing and not responding, then you need to start CPR and phone 999 or 112 for help. CPR acts to manually pump blood around the body, with chest compressions acting as the heart and rescue breaths mimicking breathing. We'll now move on to how to perform CPR in the adult casualty.
Kneel next to the casualty, next to their chest. Place one hand in the middle of the casualty's chest, with the other placed on top, and interlock your fingers. Press down 5 to 6 centimetres whilst keeping your elbows straight. Release the pressure fully, but do not remove your hands from the casualty's chest.
Give 30 chest compressions at a rate of 100 to 120 compressions per minute, which is around 2 compressions per second. Open the airway by placing one hand on the forehead and 2 fingers under their chin. Leave your fingers under their chin and use the other hand to pinch the soft part of their nose.
Place your mouth over the casualty's mouth and breathe steadily into the casualty's mouth for 1 second. Remove your mouth and watch the chest fall. If you have a face shield, you can use this. Give a second rescue breath.
Continue with 30 compressions and 2 rescue breaths until professional help takes over, the casualty starts breathing, or you become exhausted. If you are performing adult CPR during COVID-19, then do not perform rescue breaths. Instead, place a dry cloth or towel over the patient's mouth and nose and perform continuous compressions. If you are with another person, then you can swap CPR every 2 minutes.
Next, Michael will show you how to perform CPR on a child casualty. Kneel next to the casualty, next to their chest. Open the airway by placing one hand on the forehead and 2 fingers under the chin.
Keep your fingers under the chin and use the other hand to pinch the soft part of their nose. Perform 5 rescue breaths in the same way as shown for an adult. During COVID, you can still give rescue breaths to infants and children if you are willing and able. This is because a cardiac arrest is more likely to be due to a respiratory issue than a cardiac issue. If you do not want to give rescue breaths, you can give continuous compressions.
Place the heel of one hand in the centre of the child's chest and press down 1/3 of the chest depth. Release pressure but do not remove your hands. Continue with 30 compressions at a rate of 100 to 120 compressions per minute, which is around 2 compressions per second. Give 2 rescue breaths. Continue CPR at a ratio of 30 compressions to 2 breaths.
Next, Matt will demonstrate how to perform CPR on an infant casualty. Place the infant on a table if possible and place a towel or piece of clothing under their shoulders. Open the airway by tilting their head with one hand on the forehead and 2 fingers under their chin. Place your lips over the baby's mouth and nose. Blow a mouthful of air, remove your mouth, and watch the chest rise and fall. Give 4 more breaths. Give 30 chest compressions by placing your index and middle finger in the middle of the chest and press down a third of the depth of the chest at a rate of 100 to 120 per minute. Give 2 rescue breaths. Continue CPR at a rate of 30 compressions to 2 rescue breaths. Please note, an AED cannot be used on an infant casualty, so continue with CPR until help arrives. During COVID, you can still give rescue breaths to children and infants if you are willing and able to. This is due to a cardiac arrest being more likely to be a respiratory issue rather than a cardiac issue. If you do not want to give rescue breaths, you can give continuous compressions.
Finally, you'll see from Will how to use a defibrillator, also known as an automated external defibrillator, or defib. When cardiac arrest occurs, an AED can be used to deliver an electric shock to correct the heart's rhythm. Using a defibrillator within the first 3 minutes of cardiac arrest can give up to a 70% chance of survival. Defibrillators can be found in local shops, schools and community centres.
First, turn on the AED and attach the pads to the casualty's chest. It will then prepare to analyse the casualty's heart, and it will say that it is analysing. Whilst it is doing this, do not touch the casualty. It will then decide whether a shock is advised or not. If a shock is advised, it will instruct you to press the shock button. Ensure that everyone is clear of the casualty and press the button. The machine will then instruct you to continue CPR for at least 2 minutes until it prepares to analyse the heart again.
If a shock is not advised, the AED will instruct you to continue CPR for 2 minutes before it analyses the heart rhythm again. Every 2 minutes, the AED will analyse the heart rhythm and either advise whether a shock is needed or not. If a shock is given, continue CPR after the shock. If the shock is not needed, then continue CPR straight after analysis. If you are treating an infant casualty, you cannot use an AED on them, and instead continue with CPR until help arrives.
During COVID-19, you can still use an AED, but place a cloth or towel over the casualty's mouth and nose, and try to keep a distance wherever possible, for example, when the AED is analysing the heart rhythm. Thank you for watching. For more information, please visit www.sjacymru.org.uk.